So, first let's just talk about how I want you to orient this model when you're practicing. It won't be very helpful for you to just look at the model like this or hold it however it's comfortable for you to hold it and do this, because you won't be able to do that with the patient. So use the model the same way that, orient the model the same way that the patient might be sitting in the chair, which is basically going to be head back towards you and teeth kind of facing up. And if you position the patient correctly, the teeth should really be facing you. You should be, patient's head should be basically right down here and basically looking right back up at you. So you can see top and bottom, and if they turn their head to the one side or the other, you can see left and right. Okay. Now, it's difficult to hold a model and untie or tie in. Okay, so you can have a little leeway with that. This particular model is broken, and you can see at least the two pieces are not connected. So we're just going to do one at a time. Now, let's talk about how we hold an instrument first. You hold it a lot like how you would hold a pencil. If it's in, let's back up. Okay, let's talk about the instruments that we're going to use for this process, untying and tying in. This is an explorer. In some of the offices, instead of explorers, we have scalers. All right, the difference between the two is the explorer has a much smaller working edge, and including the point of the instrument. The scaler, let's talk about purpose a little bit. The explorer in dentistry is more so used to just kind of check for cavities. So, you're gonna gently be moving the explorer in between the teeth, around the occlusal surfaces of the teeth, and you're just kind of poking around to look to see if there's any decay. A scaler is used to remove tartar, calculus, staining, and so you actually are going to give it some pressure and push against the tooth to remove something. So that's why it doesn't just have a sharp point, it also has a sharp leading edge here that you can use to remove debris. Now you guys don't really have to worry about that. We just use these to remove the ties, okay? Sometimes I will use it to scale, but that's the difference between the two instruments. This particular scaler also has a ligature director on the other end. So some instruments will be, kind of have dual features. Not all, as you can see, this Explorer just has the Explorer too. So you have a patient come in for your adjustment, you're gonna untie them. Sorry, let's go back and talk about grip. You're gonna hold it a lot like a pencil. If I was holding a pencil, I was taught to grip a pencil like this, between the index finger, middle finger, and the thumb. The difference with a dental instrument is you're going to start by holding it with your index finger and thumb. Then you put your middle finger ahead of that. You can see that all three of those fingers are on the grip of the instrument. Okay, I'm not way up here. I'm not down here close to where I'm working. There's a grip on the instrument that's there for a reason, okay? The other part of using an instrument is your fulcrum. So you take your pinky finger or occasionally your ring finger, and when you're working on the patient, you want to brace your hand in the mouth on something hard, a tooth generally, okay? Occasionally, you can brace it on the gum tissue if you press gently with your finger, but you don't want to dig your fingernail into the gum tissue, and you don't want to put a lot of pressure because that can be painful to the patient. So typically, we're using the tooth as a fulcrum. So basically what it is just a stabilization so that if the patient jerks to the side, you kind of are going with the patient because you're going to keep your finger there. If you weren't using the fulcrum, when they move to the side, your instrument is now embedded in their cheek, okay? So you're going to brace what you're doing by putting your finger on the patient's tooth. That's called the fulcrum. Now, when you untie, the key to this is you don't have to use any force to untie something, okay? All you have to do is manipulate the instrument properly. So you're gonna start by putting the instrument right in between the wings of the bracket. You can also put it between the wire and the wings of the bracket like this. And you're just going to push the instrument through so that you have the instrument, the explorer in this case, between the tie and the bracket, okay? Then you're not going to pull the tie off. All you're going to do is trace around the bracket. And you can see how the tie wants to come right off, okay? Now, this is your well where you should be able to keep the ties down here. So you can scoop it like that, and then keep it on down to the end of the instrument like that. Pause it for a second.
Okay.
Okay, so we left off in part one. We were talking about, beginning to talk about how you remove a tie from a bracket, okay? So once again, you're not gonna pull the tie off the bracket. You're going to just trace your instrument around the bracket, okay? And then notice how I rotate the instrument to get it to, the tie to fall onto the instrument and away from the bracket. I'll show you again. Okay. Just like that. Okay. Now, a couple other things. So, well, let's wait till we get back around to another hook. All right, so same thing as we go around. Oh, that's why that happened. That tie is broken. Okay. That bracket is broken. I'm going to leave that one alone. Being careful with this model because I don't know when was the last time these ties were changed. But what I did on that last one, if you were carefully paying attention, is I actually started on the gingival side. I don't typically do that. I did that for this model just because it felt like that tie was tight and I didn't want to end up breaking the bracket or doing anything else. But generally speaking, you want to start on the incisal side of the tooth. So this is the gingival aspect of the tooth. This is the incisal aspect of the tooth. If you start on the gingival side, this bracket's broken, I'm going to leave that one alone. If you start on the gingival side, then when you pull, if you slip, you're going to end up in the gums, okay? So you start on the incisal, that way if something slips, you're going away from the soft tissue. Now, we're back to a bracket with a hook here, so we can use this as another opportunity to discuss some technique. The other advantage of starting on the incisal is that when you release the tie from the incisal wings, it makes the tie is no longer tight around the bracket and it's easier to get it around that long hook. If you started on the gingival aspect, then the first thing you have to do is get it around that long hook and it's already tight around the bracket. So by starting on the incisal, you release the easy wings first, you finish with the hook last, and it comes right off, okay? So now the lower, it's basically the same thing. There's really no difference. Looks like some of these O-ties are already off, but we're gonna start on the incisal. We're gonna just trace around the bracket, okay? Now right now, I can feel pressure. Here, let's discuss how we're manipulating the instrument with our hands. I can feel pressure in my fingertips, okay? You're not using your fist to do this. You're not using your arm to do this. This is all basically done just with a little bit of finger pressure, okay?
Spirit fingers.
All right, now let's talk about some of the things that can go wrong. Okay, so if you are using more pressure, all right, if you're trying to do it really fast and you're just whipping through there with your hand, you're not using your fulcrum, then if you put too much pressure on the bracket, then you can knock the bracket off. Obviously, if it slips, you can jab the patient. And if it slips, that's a little bit embarrassing because you're working on a patient and what they experience is, oh, you're moving that quickly, the instrument slips, do you really know what you're doing? Do you have control while you're working on me? So, take your time. This is, right now, what I'm doing is a little more slowly than I would normally be doing this on a patient. It doesn't take a lot of time to untie a patient. But when you're first getting started, just take your time. That speed will come with practice. Now, let's talk about one more thing. So, because I have to hold this model, there's one thing that's missing here that I'm not doing. Normally, what I would do when I'm untying a patient is I would use the mirror to retract the cheek. So the patient is here, their mouth is here. I'm gonna hold the instrument the same way with my left hand, okay? A little bit differently with the mirror. You're gonna kind of brace the mirror between your index and middle finger, and then grip it with your thumb, and then hold the instrument kind of in the web between your index finger and thumb. And you can spin the mirror around so that you can hold it whichever, retract in whichever direction you need to. But you would place the mirror here to retract the lip away from the area where you're working. That does two things. It allows you to see. It also creates a little bit of protection so that should you slip with your instrument, you hit the mirror, not the patient, okay? Now, some folks will retract the lip or cheek with their finger. If you use your finger, it will help protect the patient, but it doesn't protect you. If you slip, you can poke yourself, okay? So your mirror is your best friend. Get very comfortable using this mirror to retract the lip, protect the patient. Alright, so we'll just go on and take the rest of these ties off. This one has 2 ties on it. Somebody tied this twice. And another thing that you should be doing, as I was working my way around, you probably noticed that I rotated the model. Well, you're gonna have your patient do the same thing, but they're not gonna know to do that. You have to ask them to do that, okay? Now keep in mind, when you're working as an assistant or as a dentist or whatever the case may be, you're doing this all day long working on patients. You wanna make sure that you have the patient turn their head in a way that you can see properly, because if you are working in an uncomfortable position, where you're leaning over, hunched over the patient, turning your body to the side, one way or the other, in order to try to get to the patient, you'll be the one who suffers. You'll have a bad back, bad neck. The patient's only in the chair for a half an hour tops, generally speaking. So you have to be purposeful about asking the patient to turn their head to the side, tip their head back, tip their head down, so that you can see whatever you're working on. It's to their benefit because it helps you do your job. Most people are going to be a bit resistant when you ask them to turn. They're going to turn a little bit, but you really need them to turn more so that way you can see where you're working. So just continue to ask them to turn their head. Turn your head to the right, turn a little more, turn a little more, turn a little more. There you go, good job. And once they've turned as far as you need them to turn, then you can do your work. But just be, got another broken bracket here. Just be, intentional about making sure that you ask the patient to move their head in the directions that you can do your job best. All right, now we're going to shift over to tying a patient in. This instrument is called a mouth owl. This is what we typically use to tie in a patient. You can also use what's called a hemostat. A hemostat is basically the exact same as a mouth owl. The major difference is that the hemostat is not spring-loaded. So this is the spring on this instrument. You can see that when I close the instrument together, it naturally wants to open back up. So the benefit of that when we're doing this is when we grip an O-tie, all right, the instrument locks back here. A hemostat does the same thing. And now we've got the O-tie gripped on the plier. But instead of having to open the plier, the spring opens the plier itself, just makes it a little bit easier. Now, when you grip the O-tie, you want to grip it at the tip. If you grip the O-tie in the middle of the, what we call the lumen, where the middle of the O-tie where you see the air, that's called the lumen. If we grip it in the middle there, you have less room to work. It's a lot harder to get that O-tie onto the wing of the bracket if the lumen is not available. So you want to try to grip it each time at the edge of that O-tie, like this. So that way it's a little easier for you to grip it onto the wing of the bracket. All right, now let's talk about how we handle this instrument. Once again, you're not using it with your fist, okay? You're not gripping this thing with your hand, doing all this. This is all done with fingers. So you can see the grip on the instrument is here. When you're opening and closing it, you do use your hand a little bit because you have to give it a little bit of pressure, okay? But you try to use your fingers and just give it a little squeeze, okay? So you're squeezing it to open and close. Once it's closed and it's locked onto the O-tie, you grip it the same way you would grip any other instrument, but you grip it down here where you're working, okay? So same thing, you just, hold it between your index and thumb, put the middle finger ahead of that, and then use your pinky finger or your ring finger as a fulcrum. So now putting the ties back on, or putting ties on, okay, we'll start with the top. Same thing, have your patient turn their head, and what you're gonna do is basically move in the opposite direction that you did when you were untying the tie. Why do we do that? Why do we go the opposite direction? Well, number one, once again, the hook is the biggest piece of the bracket to get around. So if we start on the incisal edge and then we do the hook last, you have to stretch the O-tie a lot more to get it around there. So we start by putting it around the hook. That way we have to stretch the O-tie less. And now you see a good example of why we grip the O-tie with a lot of the lumen available so we can get it around. And sometimes you do have to use your opposite finger to help guide it around the wing, okay? But now it's a lot easier for me to stretch the O-tie around the bracket. The second reason why you start on the gingival when you're tying in is because if you slip into the mouth. Instead of, if you're starting on the incisal, if you slip onto the soft tissue, okay? So you're gonna just start by putting around the hook, and remember when I described untying a tie, I said you're gonna just trace the instrument around the bracket. You're not pulling, it's the same thing when you're putting a tie on. You're not pulling a tie around the bracket. What you're gonna do is you're gonna spin the instrument in your hand and guide the tie around the wings. So I'm just tracing around the outside of the bracket, and then I flip it. This is the key here, okay? I'm not gonna trace and go around and under with the instrument pointed the same direction. I'm gonna rotate it 180 degrees, and it naturally just flips right around the wing of the bracket. Now the last step here is some brackets have smaller wings than others, and so when you get ready to release, it can be easy for the tie to come loose off of one of the wings when you release. The way to fix that is to twist it one more time. So now we've got a cross there. You can see that the O-tie is crossed over on the mesial of that bracket. So that way when you release it, if you move just a little bit gingivally or incisally, you're not gonna take the tie off the wing. And once you release it, it'll straighten out itself. Okay?
Patient behind you.
Okay. I'll pause that.
Okay. It needs to be
Placing O-ties?
Yeah, I think so.
All right.
You were on I think you were on that one.
Okay. Tell me when.
You said turn to you?
Tell me.
Oh, I've been recording. I'll crop it.
All right, so we're gonna resume our instruction on placing O-ties, and then we'll move on to placing and removing power chain. So once again, grip the instrument down here where you're working. You're not gonna place O-ties out here. Get your fulcrum. Start with the hook, and then you're just gonna gently trace around the bracket with the instrument. Fingers, use your fingers, squeeze and release. Can you see that better? Or you want me to use different color?
Yeah, no, that looks better.
And you're going to continue to do that all the way around the arch. You'll have a mirror in your left hand protecting the tissue. And the other thing that you want to do is when you are tracing around the bracket, you want to avoid putting pressure on the bracket or the tooth or the wire. You're not touching, when I say tracing, you're not touching the bracket. You're going just around it, but you're not pulling the tie around the bracket. You're not stretching the tie around the bracket. So start with the hook. Let me just do this again, okay? Watch how I twist the instrument. We go around the hook. I twist the instrument 180 degrees. Then we go around the incisal wings. Then I twist it back 180 degrees. And I release while pulling away. You don't release and push in. The patient can feel that. It can break the bracket. You pull gently away and release. So now this is a good example. This can happen in the mouth. I don't know if you'll be able to see this very easily in the camera, but the hook on the canine is bent towards the tooth. So there's very little room to get the otai between the hook and the tooth. By contrast, look at the first bicuspid, see how the tie goes easily around the hook. So what do you do in that situation? You're basically just gonna kind of gently push the otai and tease it past the hook if you can. If you can't, if it's actually touching the hook, then you can sometimes bend that hook back out, but you have to be careful because you can break the bracket if you're too firm with it. So you take a scaler, something that can fit under the hook, and then you can bend the hook back. Now you've got room there. Okay, go around the hook first. Okay, now the hook is on the distal on all the brackets. So we were going around the arch from left to right, and we could start with the hook and go left to right, distal to mesial. Well, you can't go left to right and go distal to mesial on the right-hand side because the hook is now on the distal, which is on your right. So you're really going right to left as you finish out the right side. Okay. Otherwise, it's the same. Now, a couple things you want to avoid doing. All right, the hook has to be all the way around the bracket. So you don't just put it on two wings, unless you're given specific instruction to do so. Also, you would not just leave it across three wings with it going across the wire like that. You want the tie to be all the way around the bracket. If sometimes the tie will just come loose. We talked about why you twist the mathau before you release to prevent the tie from coming loose and going over the wing. If it is just going over, not over the fourth wing, then you can take your scaler or your explorer and same thing, just like you were tying it in, you gently trace around the wing. You're not going to stretch the tie to get it to go around the wing. You just kind of tease underneath it and then guide the instrument around the wing. The tie will follow where the tip of your instrument goes. Now, let's do power chain. So, number one, when you cut your chain, again, we talked about the term lumen, all right? So lumen refers to the inside of that elastic tie, but also when we count the number of elastic ties when we're putting on power chain, we call those lumens. All right, so we'll also call them links. You'll probably hear me use the term link, cut 12 links of this, 6 links of power chain, whatever the case may be. But technically the term is lumens. So if you're putting power chain on from first molar to first molar, there are 12 teeth included. So you would need 12 lumens. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. All right, so you're gonna grab the power chain at the edge of the last lumen, just the same way you would an O-tie. But you're gonna start on the opposite end. And you can use your math out to guide this. When you're placing it from first molar to first molar, it's usually pretty easy to get it on a first molar because the first molar has a hook. But then, instead of using the math out, instead of using the math out to put the rest of the power chain on, I will keep the math out gripped on the last lumen, and then I'll use my finger to stretch the power chain around the rest of the brackets. So I'm using my index finger. I have the math out in my hand like this with my middle finger, ring finger, pinky finger, and I use my thumb to kind of keep hold of it at the end. And I use my index finger, not really to guide the power chain at the bracket where we're tying, but just to give me some control going gingival and incisal. We're just gonna kind of guide that lumen around the hook, okay? Stretch it. So that it gets around the hook. So I'm using my finger a little bit more now, just to guide it around that hook. And now I can bring my finger back away from the tooth, and we're just gonna stretch it along the arch wire, so towards the teeth in the front. And the same thing that we would do with an O-tie, we're just gonna gently tease that elastic around the rest of the bracket. Now that 5 was a little tougher to get to by stretching, but as I go around the front of the mouth, you'll see that I can keep my finger a little further away from the bracket. I don't have to put forth as much effort to guide it around the hook. And then we're just gonna, as you can see, stretch it around each of the brackets, each of the wings, excuse me. So hook first, pull it down around that incisal bracket, wing, excuse me. So once again, this one's a little tougher to get to. The wire is kind of preventing the tie from going around the bracket. So in that case, there's a couple things you can do. If you can't, I was able to use my finger to kind of guide it around that distal incisal wing, but if you can't, then sometimes you can just make that the last one you get to. So you've already gone around the hook, then you can go around the 2 incisal wings. So it's still a little tougher to get to because the wire is kind of projecting out a little bit. So if you had a rotated tooth, you might experience the same thing. But you can see by contrast just how easily it went around those 2 hooks. And you just keep stretching. Again, you're asking your patient to turn. This bracket is broken, it's missing, so we're gonna leave an extra link, an extra lumen there. Go around the wings. Stretch it around the wings. Hook first, around the wings. Asking your patient to turn their head to the left. All right, and now when you get to the last one, now you're back to using your math out. It's already gripped on the last one for you, and you just take it around the hook. Some of your molar tubes or molar bands have wings like a bracket would. It is not necessary to put it all the way around those wings. Sometimes I'll ask you to do that, but in most cases, you just need to put it around the hook on the 6. Now, removing power chain. Removing power chain is very similar to placing it from the standpoint of I'm not going to remove it with my instrument around each bracket. You can do that. There's nothing wrong with that. You can use a math out to place power chain around each bracket, but it's not necessary to do that. And for me, it's easier to do it without the instruments. So first you're going to release it from the 6. You do that by inserting the explorer into the lumen of that terminal lumen. You're gonna push it into the oral cavity, not down towards the gingiva. Push your explorer down far enough into the lumen so that you can then use the flat edge of the explorer to push the power chain back around that hook and release it from the bracket. Now you might need to remove one more with your explorer so that way you have a little bit more to work with. But once you have a little bit of power chain that you can grip, you can then use your fingers again and just gently pull. In this case, remember when we remove the O-ties, we remove the O-tie from the hook last because it's the one that's hardest, it's the largest hook, the hardest one to get around. So we're gonna pull from the incisal first, then pull around the hook. And what you should notice is if you just pull, if you just stretch the power chain and take it incisally and gingerly, you can see how it naturally wants to come off, okay? So that's really all we're doing when we're removing it. So you just stretch it away in the opposite direction that you're going. This is the mandible, so I should have had it turn the opposite way. I normally go left to right, so I'm doing the opposite that I would normally do, but it really doesn't matter whether you go left to right or right to left. Hook last. Okay, so one of the reasons why I like to use my hands to do this is because you don't have to worry about an instrument slipping. You don't have to worry about pushing too hard with an instrument and potentially knocking a bracket off or something like that, or injuring the patient. You have a lot of control just by gripping the power chain with your hand, okay? So that is placing O-ties, removing O-ties, placing power chain, removing power chain.